most famous physical therapist on the internet.
Hi, folks. I'm Bob Sharp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about how to use a massage gun for knee pain relief.
Sure.
Now, we're taking a lot of this information from Kelly Starret. He's the author of the book, the bestseller, Becoming the Supple Leopard. Really changed how I do therapy, Brad. But
So, yeah, he talks about muscles, supple, or the pliability. Is that accurate?
pliability of muscles, and he always talked about working upstream and downstream.
Sure.
So if you have knee pain, we're not going to massage right on the knee itself,
no.
with one little exception. But we're going to massage the muscles downstream, which is the muscles that come up and attach around the knee joint, or upstream, the muscles that are attached around the knee joint.
Right.
So that we're going to hit kind of 6 spots. So the first one we're going to hit is, and I've done this one myself and had amazing relief from it. You say you're getting a little bit of pain from that now, Brad? Right above the kneecap?
Oh, I get that when I do some squats.
Yeah.
Or lunges.
Lunges.
And I put a lot of
That's
stress
where I
on
got
there.
it from, lunges.
Yeah.
And his theory is that this suprapatellar pouch, suprapatellar pouch, which is right above the kneecap, it can actually get bound down. So when you're doing a lunge, if that's not moving like it should be, it's going to give you pain. It's going to, and that's
there.
exactly what was happening to me. And I did everything to get rid of this. Nothing worked. And finally, I took the massage gun, and I actually started massaging it across. But I would actually go up. I used the air-filled one.
Yeah,
it's
so it's a little
very
softer.
softer. And I'd actually go right up to the kneecap and hit the top part of the kneecap.
So that'd be right where the tendon technically connects to the
Attaches,
patella.
right.
Yeah.
And I had 80% relief within 2 days.
Really?
I couldn't believe
Yeah, I
it.
remember that.
Because I was trying everything else. I was trying eccentric exercises
Sure.
and handheld massage. It just doesn't do the job.
Sure.
So-
Now, you think you could use the ball
You could try the ball.
and maybe do a cross
Yes.
fiber like
Show
this?
that, Brad. Absolutely.
So, with a gun, it it travels back and forth this way, and if you put the ball head on like this, well, you can go sideways with it, and that gives a cross friction massage.
Yes.
And
But
you don't,
pretty gentle.
Yep.
I mean,
You-
it's tolerable.
Yep. So Bob was going like this. We're going to go like this. Now, if you go like this with a ball, it's going to be more aggressive. It may be
gonna bump
painful.
along.
Yep. And I'm not even going to get close to my kneecap. This way
Sure.
is much more comfortable. So that's an option.
Yes. And by the way, this is not red. I put some red tape on it, so did Brad, so you can see against our dark pants
Right,
what
yeah.
we're doing here. So the next one, quadricep, obviously the big muscle, 4 muscles that are
Especially mine, Bob.
yeah, especially yours. Especially they play a large role in knee pain. So we want to make sure that they're not tight, and we're going to want to make sure. A lot of times you might do this massage before and after a workout
Sure.
even.
Yep.
So we're going to go ahead. You can start, hit all 4 quadrants here as far as the massage, but you can also include flossing,
Sure.
which is basically, now you could slide your foot on a slippery floor, I suppose, Brad, but we're actually going to use either the knee glide or the fit glide. The knee glide is for one single knee, used quite often after knee replacements. But the fit glide, you can actually work both legs at the same time, and you can actually get into some fitness with it out of it too.
So keep in mind the quadriceps, all 4 muscles go to a tendon that connect to the patella. So when we loosen up the quads, that takes stress off of that tendon, which takes pain away.
Yeah. So this is a great way, again, if you have surfaces that are kind of adhesed down, you push right on the surface, and you're getting movement while you're doing the massage, and actually can break up those adhesions.
Now, don't get us wrong. You don't have to have one of these devices. You could have
No.
a smooth floor with a towel on it or
Or
whatever.
a garbage bag, I suppose, would work too, right?
Yeah, if you're on carpet. Back in the old days, we used to take
A washcloth.
no, if you had carpet,
Sheet pan.
a sheet pan,
yeah.
cookie pan.
Cookie pan,
yeah,
yeah.
but make sure you clean it before you make the
Cookies.
chocolate chip cookies.
No.
But that works.
Now, the same holds true for the hamstring. You got 3 muscles in the hamstring. The same thing. You can hit the hamstring like this and work it along there, but you can also do flossing with that, which is that's one of the big advantages of what the knee glide and the fit glide.
Yeah.
You can
Well, with either one, particularly the hamstring, when it's starting to feel better,
Right.
if you can put it at an angle, this really will make the hamstrings work as you massage it, and that's going to change you. You could do it. Bob has it the other way around.
Yeah,
where,
and it kind of help the hamstring
Yeah,
while you're trying to do
he's
it.
going downhill. I'm going uphill, if you will.
So we've hit the suprapatellar pouch. We hit the quadricep. We hit the hamstring. Now the calf. The calf muscle, actually the one gastrocnemius does cross over the knee.
Yep.
Don't hit right in the back of the knee, the popliteal fossa. There's a lot of nerve, artery, and veins there. You can hit right in the top part of the calf, but don't go right behind the knee.
Yep.
Now, this is one I do every day because my calves have been so sore. I've been really working them lately, and I started going back to standing at my desk, Brad.
Yep.
And it's amazing what a difference it makes,
Sure.
how much they're working. So, again, if these muscles are not real tight and they're loosened and pliable, they're going to put less stress on the knee. All right, so we hit the calf muscle. You could also do a little flossing with this. I mean, you could just go like this,
Sure,
move back and
yeah.
forth.
Up and down like
Let's
this.
go talk about the IT band now, Brad. So,
Wow, this is feeling so good. We have to stop.
yeah, you can keep going while I'm talking.
Yeah.
So we got the tensor fascia lata, which is a muscle. It attaches into the iliotibial band, which crosses all the way down. It crosses the knee, goes into the fibula, I believe.
It's just like that.
Yeah, just like that stripe. Now this is a heavy band. You can't stretch this band. You could lift a Volkswagen with it, but
They talked years ago that you could stretch it and get results, but you know,
well, I think if you stretch it, you stretch the tensor fascia lata.
yeah,
'cause
the
it's
muscle
attached
belly
yeah.
up here.
But what it happens quite often with this too is the band gets adhesed down to the body, so it does help to massage it to loosen up the adhesions, and so you can get some more motion and will put less stress on the knee because you get a lot of people get runner's knee or biking from this. If they bike, they get a lot of overuse injury.
Yeah, especially if your bike may not be adjusted properly as far as the seat height. But yeah, and you can see we got different guns here that we're using. And
Yeah.
the smaller one, boy, these pack a lot of power. So
Surprisingly so. This, believe it or not, it's the one I have at home right now. And the thing about it is you can really get a grip on the handle and really apply pressure. I'm just shocked at how well this one works.
well, you know, there's not a lot of muscle on this part of the thigh, so you may not want to go in too aggressively and maybe work at an angle or just turn the gun down.
Or use the air-filled one again.
Exactly.
So-
Yeah, a lot of options.
All right, final muscle group we're going to hit are the hip adductors. That's on the inside of the thigh, kind of going up to the groin. If they're tight, they can cause your knees to be knock-kneed, which can cause pain
Yep.
if they're not being in the right shape. So you can just work along the inner thigh and work the muscle groups there. And
I got to be honest with you, Bob. Once I got in my late 40s, this muscle group, which I never had a problem with running decades before, all of a sudden in the spring, when I'm not in running shape, I would get,
you feel it.
yeah.
I feel this muscle group when I'm squatting
Oh, really?
a lot. This is probably the one I feel the most.
Sure.
It's and I'm like you. You know, when you're young, you can get away with everything.
Yeah.
But when you get
For
older,
some
you can't
reason.
get away with anything.
Yeah, it's really not fun. It takes some of the fun away, but then you know we're on the job.
We're on the
We're trying to cover your back.
we're on the slide down. By the way, this video is a part of a series of videos on massage. If you want to see the entire series, go to bobandbrad.com, go to the program section, and look for the title. There's massage. There's actually a bunch of them that we have there. One on sciatica, one on tens, one on plantar fasciitis.
Yep.
So
Et cetera,
you
et
can check
cetera.
those out. Yeah. Go to the massage one. We're going to have, I don't even know how many. We're going to have 20 to 30 videos there.
Sure.
Pick out the ones that pertain to you and check them out. You can watch the ones that you
Right.
only need.
Yep, they're usually 10 minutes long or so. Watch it, and then there's a PDF button. So if you click on that and your computer's hooked up to your printer, it'll print out 1 or 2 pages of a review of the whole video. So you don't have to go back and keep looking at it if you kind of forgot something. We do all this. It's absolutely free. We don't even ask for an email.
One last point, Brad,
Oh,
here I want
yes.
to make here on the muscles. Generally, what I've found is, and it's been stated, is that if there's no pain or discomfort when you're doing the muscle, you may not need to massage it. You know what I mean?
Sure.
Generally, you're looking for the muscles that are sore,
Yep.
that are tender when you hit them. Like I no longer massage my hamstrings because they seem to be fine. My
Sure.
calves, I spend a lot of time on them.
Yep.
A lot of time on them. So hit the ones that are sore and leave the other ones alone. We're all
I mean, you could if you want because it feels good, can't
yeah,
you?
we're
'Cause
all
it's
time
fun.
starved though, but so you want to allocate your time wisely.
Sure.
All right, remember Brad and I can fix just about anything.
Except
A
for,
broken heart.
right, and we're going to figure out some way maybe these are going to help.
Don't go over your heart with this.
Yeah. And I'm going over my chest muscle. That's my pectoralis major.
Yeah, yeah.
All
All right,
just
thanks.
playing.